Have you ever felt strange after taking your medication? Maybe a little too tired, dizzy, or just not yourself? What if I told you it might not be the medication at all? Here's something most doctors don't mention. Certain everyday foods, yes, the ones sitting innocently in your kitchen, can completely change how your medication works. Some can make your pills too powerful, causing dangerous side effects, while others can weaken them, leaving you unprotected. And the worst part? These food-drug combinations are shockingly common among people over 60. So today, we're uncovering the top 5 foods you should never mix with your medication. And chances are, you're eating at least one of these every week. If you're currently taking blood pressure meds, statins, blood thinners, antidepressants, or even simple allergy meds, this episode could help you avoid serious complications. Let us know in the comments. Have you ever experienced a weird side effect after eating or drinking something with your medicine? Your story might just help someone else. All right, grab a glass of water, not grapefruit juice. We'll explain why. Before we get started, do well to hit the subscribe button so you don't miss powerful health tips like this. If you've done that, let's get started. Now, let's begin with first on the list. Number 5. High potassium foods plus ACE inhibitors, like lisinopril. Let's start with something healthy that turns risky with the wrong medication. High potassium foods. We're talking about bananas, avocados, oranges, spinach, sweet potatoes. These are all loaded with potassium, great for your muscles and heart. Unless you're on ACE inhibitors like lisinopril, enalapril, or ramipril, which are prescribed to lower blood pressure. Here's the problem. ACE inhibitors already raise potassium levels in your blood. Add high potassium foods, and you risk developing hyperkalemia, a condition that can lead to irregular heartbeat, muscle weakness, and even heart failure. A 2014 study in the Journal of Clinical Hypertension showed that older adults on ACE inhibitors had significantly increased risk of hyperkalemia when they consumed potassium-rich diets. Watch out for signs like muscle cramps, numbness or tingling, slow or irregular heartbeats. So if you're on blood pressure meds, be cautious about loading up on avocados or bananas every day. Your doctor may recommend a low-potassium diet to balance it out. Number 4. Grapefruit plus statins, blood pressure, anxiety, or allergy meds. This next one is legendary for messing with medications, and yet, many seniors still drink it with breakfast. Yes, we're talking about grapefruit, or its juice, extract, or flavored waters. Grapefruit contains compounds called furanocoumarins, which interfere with an enzyme in your intestines called CYP3A4. This enzyme is responsible for breaking down many medications. What happens when grapefruit blocks that enzyme? Your medication stays in your system longer and at much higher levels than intended. This is dangerous for drugs like statins, like atorvastatin/Lipitor or simvastatin, calcium channel blockers, like amlodipine, anti-anxiety meds, like buspirone, antihistamines, like fexofenadine. Research published in the Canadian Medical Association Journal found that grapefruit can increase statin levels in the blood by up to 700%, raising the risk of muscle damage, liver problems, and kidney failure. Bottom line, if you're on any daily medications, check with your pharmacist before reaching for that grapefruit. Or better yet, switch to orange or apple juice just to be safe. Number 3. Dairy, especially milk and yogurt, plus antibiotics, like ciprofloxacin or tetracycline. Milk, yogurt, cheese, calcium supplements. They're great for your bones, right? Well, unless you're taking certain antibiotics. Antibiotics like ciprofloxacin, Cipro, or tetracycline bind with the calcium in dairy products. This binding creates an insoluble compound that your body can't absorb, meaning the antibiotic won't work properly. A study published in Antimicrobial Agents and Chemotherapy showed that calcium can reduce the effectiveness of ciprofloxacin by over 40% when consumed at the same time. This interaction is especially dangerous for seniors recovering from infections. Your body needs that medication to work fast. Simple fix. Take your antibiotics at least 2 hours before or 6 hours after consuming. Milk, yogurt, calcium-rich foods, supplements, or antacids. That gives your digestive system time to process both substances without conflict. And always read the label. Some prescription bottles even say, "Do not take with dairy products," but pharmacists sometimes skip that warning. Pro tip: ask your doctor if your antibiotic comes in a non-interacting form. Some newer antibiotics don't react with calcium at all. It's worth asking about if you take supplements daily. Number 2. Caffeinated beverages plus asthma or depression medications. Love your coffee or tea in the morning. That's fine, unless you're on certain medications that interact with caffeine. Here's what to watch out for. Theophylline, used for asthma and COPD. MAO inhibitors, older antidepressants like phenelzine. Caffeine and these meds overstimulate your nervous system, which can cause rapid heartbeat, insomnia, high blood pressure, anxiety, and restlessness. In fact, theophylline and caffeine are structurally similar, so drinking coffee while on theophylline is like doubling the dose. One study from Chest Journal showed that caffeine amplified theophylline side effects in seniors, increasing risk of heart palpitations and seizures. What to do? Try switching to decaf, or limit yourself to 1 small cup per day while on these meds. And again, always check with your doctor or pharmacist about caffeine interactions. Number 1. Alcohol plus almost any medication. Finally, let's talk about something you probably already suspect: alcohol. Whether it's a glass of wine, beer, or even a cocktail, alcohol can magnify the effects of many medications, or even make them toxic. Some of the most dangerous combinations include blood thinners like warfarin. Alcohol increases bleeding risk. Sleep aids like zolpidem may cause blackouts or falls. Pain meds like acetaminophen. Alcohol stresses the liver and can cause damage. Diabetes meds may cause severe blood sugar drops. Antidepressants increases sedation and mood swings. A 2019 study in the American Journal of Geriatric Psychiatry reported that seniors who mixed alcohol with antidepressants had 50% higher risk of cognitive decline and memory issues. Seniors are more sensitive to alcohol than younger adults because of reduced liver function and slower metabolism, meaning the effects last longer and hit harder. Bottom line, if you're taking any medication regularly, talk to your healthcare provider before drinking. Even just 1 glass could be doing more harm than you think. There you have it, the top 5 foods you should never mix with your medication. Let's quickly go over the top 5 foods you should never mix with your medication, just in case you missed any. Number 5. High potassium foods plus ACE inhibitors, like lisinopril, ramipril. Examples: bananas, avocados, sweet potatoes. Risk: too much potassium can lead to irregular heartbeat and even heart failure. Number 4. Grapefruit or grapefruit juice plus statins, blood pressure, anxiety, and allergy meds. Examples: atorvastatin, Lipitor, amlodipine, fexofenadine. Risk: grapefruit blocks drug breakdown, causing overdose-level side effects. Number 3. Dairy or calcium plus antibiotics, like ciprofloxacin, tetracycline. Includes milk, yogurt, cheese, calcium-fortified juice, and antacids. A risk: blocks absorption, antibiotic may fail, leading to infection or resistance. Number 2. caffeine plus asthma or depression medications like theophylline and MAOIs. Examples: coffee, strong tea, energy drinks. Risk: overstimulates the body, causes rapid heartbeat, anxiety, even seizures. Number 1. Alcohol plus almost any medication. Examples: warfarin, zolpidem, acetaminophen, metformin, antidepressants. Risk: boost sedation, liver damage, internal bleeding, memory issues, and more. Now it's your turn. Have you ever had a strange side effect from a medication? Drop a comment below. It might help someone else spot a dangerous food combo before it's too late. Thank you for watching. Share it with someone who needs better health. And if you're over 60 and serious about aging well, staying independent, and protecting your health, subscribe to our channel. We've got more videos coming on how to protect your body, your brain, and your quality of life naturally. Don't go yet. Check out our videos on your screen and rebuild and maintain a better health before it is too late. Stay strong, stay healthy, and stay young at heart.